Hi, thanks for joining us today for Adding Incentive, How to Offer Continuing Nursing Education. I am happy to introduce our Director of Educational Resources at STTI, Matthew Howard, who will be talking us through the process today. I do want to let you know that this presentation is being recorded so you can watch it at a later date. You can also feel free to remain interactive on the line using your control panel located in the upper right-hand corner of your screen, where you can raise your hand to request your line be unmuted, or you can type your comments or question directly into the question log and hit send. That will come to me where I can read those back to Matt to incorporate into the presentation. So I will turn it over to you, Matt. Thanks again for being our presenter today.
All right, thank you very much. Again, like Michelle said, my name is Matt Howard. I'm the Director of Educational Resources here at Sigma Theta Tau International. I've been with Sigma as a member since about 2005, but I've been with Sigma as a staff member since August of 2013, starting out as a manager of education and then moving up into the director spot. My responsibilities here at Sigma include being over publications, all of our publications, all of our books and our magazines and our journals come through. The Henderson Repository, the Career Center, as well as the Education Department, which is where this comes into play. I'm also the lead nurse planner for Sigma Theta Tau International's Continuing Education Department. So I am ultimately responsible for the majority of the planning and the CE that we actually give out. So let's get started here. We've got about 30 minutes or so worth of information to go through and then be able to open it up for questions after that. The purpose of this overall presentation is a presentation I actually gave at Leadership Connection 2016. And if you want the slides that are on this particular presentation or this information, just go down to the bit.ly that you see down there, the URL, the www.bit.ly/LC16 repository. And in the repository, the Henderson repository, simply search for LEAD 16, E as in Edward 03, and you'll find this particular presentation. The overall purpose, like I said, is to explain the process of how to offer continuing nursing education hours for events, and offer a couple different types of tips essentially for success with meetings in general. We're going to talk about some of the importance about making meetings and making things a benefit for our membership and for our members themselves, specifically benefits that members need and want. We're going to talk a couple different avenues of obtaining CNE contact hours for chapter events or just in general chapter meetings, period. So we started out with a little bit of basic information here, talking about how to increase your member engagement, how to figure out who your membership actually is, what do they do, are you able to talk to them, are you able to get information from them. So one of the ways that we do this is trying to figure out how do you engage that member. How do you actually find out who they are? Oftentimes, for us as Sigma itself, the majority of our members, at least as they come on board initially, are students coming from our university systems. So it's easy to figure out for that particular section who they are, but who else is within your membership? Does your membership just hold students only? Hopefully not. They hold other people that have been through that process and remain a member of Sigma through their professional career. So figure out who they are, what do they do, use social media, use the circle oftentimes, and give them the opportunity to talk back to find out what do they actually need, what do they actually want. One of the big things that we have an issue with Sigma in general is retaining some of our members. And one of the big issues with that, or the reason is that, is because we don't do a great job of articulating what a huge benefit Sigma is to people. And that's one of the things that we really need to be able to do much better as a whole, as all of membership, period. So engaging the members in general, you want to look at realistic engagements, okay? Realistic engagement goals, pretty much in everyday terms. So find ways to be able to connect with those members on an individual basis, if at all possible. Help them to make those connections with people. A lot of the reasons that people join Sigma, that people stay joined Sigma, is because of the connections that people can make, that networking that we do with this. It helps to be able to show, obviously, the members themselves that you care about them and that you value what they have to say and what their thought processes are. And help them to be able to verbalize and internalize what our company's mission essentially is. And this is just basic information. I mean, literally came from multiple different types of websites about how to engage employee benefits, how to engage employee membership, how to engage membership within our own institution as well as in our own chapters themselves. The other part is looking at their well-being, because a lot of this stuff is exactly the same what we would do for an employee and how we would want to be treated and want to treat our members. We want to make sure that they have a voice in what's going on, provide compelling content, and actually build that overall community in general. And that's really what we're looking for. So we have different types of members, right? We have prospective members, which of course most of our students, passive members, engaged members, and then ambassador members. So my question to you is to think about, really, where are you on this spectrum? Where do you go in this particular line of succession here? Do you sometimes go from passive to engage and then come back to passive? Or do you become an ambassador and then maybe come back to engaged at some points? I think we've all had those ebb and flows essentially with our membership, specifically at Sigma Theta Tau International, because oftentimes we become very engaged and other times not so much. So how do we do that? Where are the majority of your specific members in your chapter? Do you consider them passive? Do you consider them engaged members? Do they come to meetings? Do you have meetings? Those kind of things. Those are the things to think about. The other part is members feel more engaged when they are confident that they know both the mission and what it takes to advance it. Do you know Sigma Theta Tau International's mission? Can you figure out, do your members know that mission? How can you get that information out there to them? How can you make sure that they stay and remain engaged? Because the question is, whenever I gave this presentation at leadership and I asked that particular question, how many in the audience know what the mission and vision is for Sigma Theta Tau? They were able to talk a couple of talking points, but no one could really give me that information. So if you're not able to do that, and most of those people were what we would consider engaged, if not ambassador members, if they're not able to do that, how can we expect others to? But the members feel more engaged in their association when they know, when they are confident that what they're doing is fitting that particular mission and they actually go with that particular mission. So I'm going to ask a couple questions here. Okay, speaking of engaging, we're going to engage you in the conversation here. So, as far as membership goes, do you hold meetings? We're going to ask that question and put it up as the poll real quick and see how many of you do hold meetings and how many don't. So the poll's open. So take a couple minutes here. It's a very difficult poll, I know. But do you host regular meetings for your chapter? Michelle, I'll let you end it whenever you think it's best. All right, so perfect. 100% of you, great. You hold meetings regularly. That is absolutely awesome. Now my second follow-up question is, what do you consider regularly? Is regularly monthly, quarterly, twice a year? Is it weekly? What do you consider regular? Michelle, again, I'll let you close whenever you feel it's good timing. All right, so they're coming back, definitely. This is very typical from what we see for Sigma types of engagement. Quarterly meetings is actually on the higher end. The majority of them have meetings twice a year essentially. Now, my particular chapter does have meetings, but they're typically more of board type meetings where just the discussion of the actual the workings of the society essentially come into play and come into be discussed. But is that enough? Is that enough to actually engage the members? And that's really what I want you to think about. Is that enough to actually engage the members? When you have these meetings, do you have members at your meetings? Are they a lot? Are they a few? If there's not that many, what do you think their barriers are to actually coming to those meetings? That's really what we want to know. What are those barriers themselves? Once you find out what those barriers are, what are you going to do about those? So if you know what those barriers are, how are you going to know that information? And then how are you going to fix it? How are you going to engage it? How are you going to keep them there? Okay? My last question that I'm going to ask, at least in this section for a second here, is really going towards what do your participants get out of the meeting? What do they actually get back from that meeting? Once I leave that meeting, what am I going to get out of your meeting? So, my question is, or my next question I should say, is have you done or attempted anything to get people to come into your meetings? Because the majority of the people, whenever I gave this lecture the last time at Leadership Connection, they didn't have a lot of members or a lot of people coming to their meetings. So then we yelled out a couple of different things that people could do and a couple of different things that people could say essentially to be able to get people to their meetings to get them there. A couple of those things that we talked about, food and beverage. If you feed them, they will come, right? And that's typically what we have found in the majority of the events that we have. If you feed them and you feed them decently well, they will come and they will continue to come back. And that's absolutely perfect. That's what you're wanting to do to be able to do that. And I'll give you a couple of things that you can do to be able to afford, if you will, some of that stuff. The other part is consistent meetings. Consistent meetings is the next one. If I know I'm going to have this meeting every other month, it's the second Tuesday of every other month kind of thing, or third Tuesday of every other month, whatever it is. If it's consistent, I can plan around it. If it just seems to pop up, oh yeah, by the way, we have a meeting next week, I'm not going to be able to plan for that, and people don't see that part. The other one is a consistent message. If you have a consistent message going out there to the membership, these are when our meetings are, this is what we're going to have at there, this is what we're going to have at the meetings, and this is what we're going to do at the meetings, and this is why you should be there. They get a sense of this is part of what I need to know, this is part of what I need to be involved in, what I need to do in. And then they start to be able to see and have that information as value added, right? They see there is something there for me. And one of the things that we do to be able to add that value is continuing nursing education, which I'll talk about here in just a moment. We'll go into that. I want to give a couple of best practices, if you will, about what you can do to actually get people involved and get people coming to your events. One of the things that I have done in a couple of different organizations that I've been in terms of getting people engaged and getting people coming back to our events is that food and beverage area. Well, I don't know about your particular chapter, but my particular chapter isn't all that wealthy, right? Most of them, unfortunately, aren't all that wealthy. So how are we going to afford to pay people or pay for people just to be able to come and eat and be able to talk about the association, etc., and then be able to go home, right? So one of the things that we started to do is we got our consistent schedule our meeting schedule listed up. These are the meetings we're going to have throughout the year. And then we went out and we actually got vendors. One of the ways we actually got vendors is because we actually polled our constituents, we actually polled the members and asked them, Out of all the members that we have, what are your job descriptions? What do you do? That type of thing. But the bigger thing is we asked, do you at your university, do you at your hospital, do you at your wherever you work, do you have the ability to make decisions about purchasing? Do you make the ability to have decisions or make decisions about what your facility uses, what your hospital uses, what your university uses? And oftentimes we'd get people that would come back to us and say, well, I'm faculty, I don't, I may pick a textbook, but, sometimes that's even regulated by a different group. I don't have any ability to do that kind of stuff. What we started to find when we really talked to people is they do have the ability to give input in what textbooks we use, or specifically what simulation products we use, what simulators we use in the faculty realm, in the bedside realm, if you will, the clinical realm. People are able to get input in terms of, we like, I don't know, these IV catheters versus these. We like to use these ultrasound machines versus this, whatever it is, these bandages versus these other bandages. If you can sell it essentially to a vendor that a lot of the people, most of the people, the majority, whatever percentage you have of people that can come to your meetings, again, can come to your meetings, are decisions makers, then those vendors will then put money into you and sponsor, say, a dinner at wherever for you, wherever your hometown or wherever you typically have these particular meetings. One of the meetings that we had for another association that I belong to here in downtown Indianapolis, there's a restaurant, a very, very nice upscale restaurant, if you will, called Ocean Air. It's a seafood restaurant that literally flies in seafood every day, fresh seafood every day. Okay, so as you can imagine, it's going to be pretty expensive. We had a vendor that paid money to be able to take and send all of us there, and if you probably can imagine, that was one of our highest member attended events that we had, because you say free food, okay, you say free food at Ocean Air, where most of us don't ever get a chance to go because it's way too expensive. They were there to do that. Make it give them an incentive, give them value added. Okay, get them to come. Once you get them there, what are you going to do with them? That's where we turn into our CE part. So there's many different types of avenues to go about obtaining continuing nursing education for your events. Those avenues can be state nurses associations. Each state nurses association essentially has some way to be able to give CE. A lot of them actually now have started to use the Ohio Nurses Association. That has been one of the hallmark groups essentially for, as far as the state association goes anyway, as a approver unit to be able to approve somebody else doing continuing nursing education. That's been one of the great ones that's out there right now. But there are several others that do this. California has its own organization that actually gives out CE, etc. So there's many different types of state organizations. You can use your college or your university or your facility themselves that give out continuing education, or other specialty nursing organizations. Now, one of the questions that I got about this point in time whenever I started this particular presentation at leadership was, I said specialty nursing organizations, so they asked, does Sigma do this? Can Sigma Theta Tau International actually be able to approve other people to be able to give CE? The answer to that right now is no. We're not able to do that. However, we are working on it. We right now are a provider unit, meaning Sigma Theta Tau International can provide or can give CE for the work and the education that we as Sigma proper provide to you. We are working on becoming an approver, which would give us the ability for Tau Lambda chapter, if you will, to be able to send in specific paperwork, and if it met all the criteria that was needed, then Sigma would be able to approve them to then go out and give that CE on our behalf and then send back the paperwork to us afterwards. We are working on being able to do that. As of yet, we're still in the process of that part. But there are many other specialty nursing organizations. So specifically, if you have an organization in your area or another national specialty nursing organization, most of them that do have approver units, you can apply for their approver unit and actually get approved that way to be able to give CE. So what process do you have to go through to actually develop those? And that's what we're going to talk about for the rest of the time. The overall process is looking at a specific timeline for how you have to do this, because there's specific paperwork and stuff that you have to be able to do. One is you have to have a targeted need, right? You can't just go out and say, I'm going to give education just because I want to give education so people will come. You have to have an actual desire, an actual need to be able to do this. So you have to identify what that need is and look at who your target audience is. If you're really going to target faculty, that's who your membership and who of your membership that you really want to get involved a little bit more from surrounding universities, surrounding schools, surrounding colleges, etc., then that's your target audience. Go for it. But define who that target's going to be. Look at that needs assessment and do that gap analysis. See why is your education actually needed. And anymore, these are the steps that anyone has to go to and has to go through if you actually want to be able to give continuing nursing education anymore. You have to know what that gap is so that you know that you're meeting or not meeting that gap when the thing's done. You have to define a specific purpose, a specific goal of why you want to have that education. You want them to be, give you back in your evaluations themselves that they have a better understanding of whatever you were talking about. They have a self-improved score essentially from when they started versus at the end of your presentation that was given. And that all goes with looking at what you want your outcomes to be. Okay. From there, then you develop the objectives or the outline information, your content, you do your evaluation, and then you write up your summary. That's the overall timeline, if you will, and the overall process for what needs to be done. Now let's take each of these and we'll go through a little bit more here. So the first thing we wanted to do is identify the need, right? So needs ID. When you do that, you note not just a problem in practice, okay, but you're looking at opportunities for improvements as well. Has there been an update in specific guidelines that have come out? That's what you want to make sure that people have a better understanding about. Are there new regulatory guidelines that are coming out? Let's say CNE comes out with different guidelines or different updates information, and that's who your college is accredited through. You want to make sure people know that information, right? That could definitely be a need that needs to be taken care of. Maybe there's issues with patient care that actually start discussions with people. Either new or updated educational issues or even management related issues. Any of these things can be some of the needs that you're looking for to spark, this is what we want to talk about, this would be a great topic. I'm on one of the planning committees for the Emergency Nurses Association within the state of Indiana, where I'm at here. And one of the things that we have as a big, obviously is a big issue around the nation, this particular nation, but definitely in Indiana, is an issue with opiates, specifically overdoses. So that's one of our big educational needs that we're definitely making sure that we're meeting. And you can have multiple versions and multiple different needs. It all depends on how much time you're going to put in with each of those to actually make sure you have a good outcome afterwards. So think of all the different types of things that you could be talking about and then select that target audience. So if you're talking about the opioid crisis in the United States, and you're really going after med-surg nurses, is that really going to be the best way for that information to be going to? You know, who's actually impacted by the problem or the opportunity? That's what you're really wanting to look at. Who are the nurse learners that represent that particular audience? Are you going to be going after community-based nurses, med-surg nurses, nurse managers, nurse educators, clinical faculty? Who is it that you're really wanting to get that information over to? One of the studies, it's an older study now obviously, but it's one that I really like to kind of push out to people to really get an idea, because the study's been replicated since, but this was the original, and one of the originals in 2004, was that younger nurses less than 35 years of age want CE. The problem is they tend to get little support from coworkers or little support from leadership or people at their facility to get that continuing education. In general, they want to know things because oftentimes they come out knowing that they don't know what they think they should have known or think they should know, period. Continuing education, that lifelong learning drive should begin immediately after graduation. It's one of the things that we should be pushing, of course, is continuing them along with this CE thought process that lifelong learning continues. It doesn't just stop once you get out of nursing school. You have to continue to do things. So once you've done that, you look at your needs assessment. So look at the national data indicates that nurses that are certified, specifically in their specialty area, give safer care to their patients. That's definitely one of the things that I was able to utilize in one of my needs assessments to be able to state, this is why I need to be able to have this type of education. This is why I need money essentially from my facility to provide education to get more nurses certified, because we have better patient outcomes if we do that. Those needs assessments come from surveys, from interviews, from observation, independent observation reports, evaluation forms from previous events, that kind of thing. Focus groups, as well as you can use national benchmarking data to be able to give that needs assessment. So the other question is why? Why do we need the needs assessment in general? Well, you need that data to identify and validate that you actually have a gap. And this is a big key for continuing nursing education. You're going to identify essentially, do you have a gap in knowledge, skills, or practice? You may have a gap in all three or two of the three. The thing that I'll tell you about is if you identify a gap in knowledge, skills, and practice, specifically skills or practice, you better make sure that whenever you're developing your education that you're actually being able to meet those particular gaps. If you can't meet those gaps, then what good is the education? If they don't have a gap in knowledge, but they have a gap in how to do a skill, say for example putting in an IV, and all you do is talk about how to put in an IV, are they really going to get better at putting in an IV? No. You have to be able to make sure that what your needs assessment tells you is going to, what your needs assessment gives you, you're actually going to be able to do something about at the end and actually give them a good outcome for that. There's multiple ways to be able to get that data and get that information. Again, we talked about that, the surveys, the lit reviews, outcome data, specific targeted requests in general. Those are some things that you'll be able to do to be able to get that information back. And then again, that tells you where is the gap, okay? What is the difference itself? What does your audience know now that they didn't know 20 minutes ago, 30 minutes ago? What are they going to know afterwards once you actually get done? So again, that gap comes in the terms of knowledge, skills, and application, or one of each, okay? And that's absolutely normal to do that. Know the assessment itself helps you to clarify the areas of discomfort and helps to target your learning activity. Again, helps to target your learning activity. If you go through this whole process, the problem, where's the problem? Is it a lack of skills? Is it a lack of practice? What is the issue? You go through this entire circle, you'll be able to figure out exactly what type of information needs to be given to your participants. Excuse me, you want to be able to answer the following questions essentially in this sentence here, right? What is the current ability of the target audience related to this topic? What can they do now that I want them to be able to do something different, right? Is there a difference between their current abilities and the desired abilities? Do they not know something now? Is this a lack of knowledge? Is this a lack of skill that I want to make sure that they do know afterwards? What is the desired ability of the target audience related to this topic? And then what evidence supports that particular gap? Again, this is what helps you figure out what specifically you need to talk to your people about so that they will actually be involved in what you're talking about and what you're doing, and so that they come back for the next event. Getting your goals together, setting those goals and setting that purpose. Again, this is a broad outcome statement. They've gotten away from objectives in each individual thing. Now we're using these broad outcome statements. At the end of this is what we're going to be doing. Addressing that identified gap in either skills, knowledge, or practice. So take you through a couple of the things that we do here as far as looking at our purpose statements. So a purpose statement shouldn't be a statement of the purpose in providing the activity. Purpose statement definitely should be what you want the learner to know or what you want the learner to be able to do at the end of that event. So let's take a look here. The purpose of this activity is to provide education surrounding the care of the patient with myocardial infarction. Okay, how are you going to prove that? How are you going to look at an outcome and say, yes, they've done that? Versus what it should be, the purpose of this learning activity is to decrease the recognition time by registered nurses of a patient with an MI. So now I'm giving some more, a little bit more specifics. I'm looking at actually decreasing the recognition time. So the fact that nurses can look at a patient, look at a patient's lab values, look at a patient's EKG, whatever, and be able to say, yes, this patient's having an MI at a quicker rate. Okay. Determining your outcome, you have value in developing these specific measurable outcomes. Some of these may be, on completion of the course, participants will achieve an 80% pass rate on the post-course assessment or the test. Maybe you want to look even further down the road, and within 4 weeks of completion of the course, 60% of the door to AMI recognition time be less than 10 minutes. One of the ones that we've actually had gotten some feedback from some of the people is at events themselves, from one meeting to the next, that's how they'll do their evaluation. So they'll do a post-evaluation right after their education that they gave in, let's say, January. Their next meeting is in March, and before they start the next meeting, they actually give that same post-evaluation that they gave in January in March. And what is your retention level to those same people that were there, right? Do they actually hold on to that information? And that's one of the ones that they've started to use, and I thought that was an absolutely great idea to be able to do that. Again, if you can get them there consistently, people going each and every time, you'll be able to do those kinds of things, and that really helps to be able to show that yes, your education is great and that people really learn from it, one, but two, people come back and people remain and stay engaged. One of the last ones here is the objectives and the content development. Again, you put that purpose statement, again, that broad statement of the learner themselves. You look at the specific measurable objectives, something that you can actually measure. You develop your content based on that gap analysis and based on that information that you've gathered from your participants, and then evaluation measures. What have you identified is this is what I want to look, this is what success is going to look like for this educational activity. This is what success is going to look like for this meeting. I'm going to have 15 people here at this next meeting. I'm going to have 30 people at the next meeting. The meeting after that, I'm going to have 50. What does success look like? Again, if you don't have a goal, if you don't have an outcome, if you don't have a purpose for doing these meetings, what is the point of it? How are you going to push with those things? And that's really what you're looking for. Evaluation and documentation, again, determining the criteria for successful completion is what's really going to help you to be able to do that. What the learner will be expected to know, or what the learner will be expected to do once you actually get done with the education and the meeting itself. And based on the importance of the content as well as the needs assessment, all this information then gets documented, and that evaluation is formed to help you go on and further do additional courses. So your evaluation helps with multiple factors and multiple points of interest, whether it's looking at increasing grades or communication skills or teaching or other studies that may need to be done. other information that need to be done. There are many other ways to be able to evaluate and many other reasons to be able to evaluate what you're actually doing. So putting this all together, essentially, you come up with this. You come up with something to be able to put your objectives or your overall outcomes, your content, how long you plan to spend on this stuff, facilitator who's actually going to be doing it, and then your teaching methods. How are you going to do that? Is this going to be a lecture type stuff like it is right now? Is this going to be interaction? Is it going to be discussion? Is it going to be case-based? Those are the kind of things that you're really looking for to figure out what you want to do moving forward with your educational activity. So let's give you an idea of how these things are put together. So here I have, and the course this is taken from ANCC, their Commission on Accreditation, and their writing objectives essentially for educational activities. They list out the desired state, the current state, identify that gap, what is the analysis of that gap, develop your purpose statement, and your outcome measure. Now, me being an emergency nurse by training, essentially, picked a course in emergency one. So the desired state, pediatric patients in respiratory distress are placed on a non-rebreather mask that is applied appropriately within 5 minutes of presentation to the emergency department 100% of the time. Is that something that can be measured? Is that something you can get an actual outcome out of? Did we meet the 5 minutes 100% of the time? Did we meet 5 minutes 90% of the time? That's something you can actually measure. The current state, pediatric patients that are in respiratory distress are placed on the face mask support within 5 minutes of the presentation to the emergency department 100% of the time, but the frequency of the face mask, the face mask is not applied appropriately. So the issue there, of course, to identify gap is a skill in applying the non-rebreather face mask to the pediatric patient that's in respiratory distress. That's where you find out what the actual gap is. So that gap analysis is a lack of skill in applying the face mask to those types of patients. So the purpose of this educational activity this person was giving is that RNs in the emergency department will apply non-rebreather masks support correctly to all pediatric patients in respiratory distress. The outcome measure, successful retention of this application on pediatric patients. Participants must correctly assess signs and symptoms of respiratory distress and apply the non-rebreather face mask correctly. It's a very specific example, but it gives you an idea in terms of what kind of specificity you do need to put in when you're developing continuing nursing education information. So, last slide in summary here. What we're looking at is to review your information overall. You know, does it meet the specific gap that you're looking at? Do you have specific outcomes? And are those outcomes measurable? Oftentimes we tend to think or tend to see just giving people a post test. Well, not everyone achieves 100% on the post test. If they do, something's wrong with that test, right? Will the educational activity have the overall effect that you actually desired? And to be able to figure that part out, you're actually going to have to do the homework essentially to figure out what do I really want them to have? What do I really want them to know? But most importantly, will your membership be engaged? Will they come back for the next one? If this was a good educational opportunity here and I got something out of it and I got CE out of it that I need for licensure or for certification, whatever it is, will that make me engaged? And how important does that seem to me, right? At the majority of the meetings that I go to at a state and a local level for the Emergency Nurses Association, I get a free meal. I get free at least 0.5 CE, so half an hour's worth of CE at every event that I go to. So that's 12 free meals a year and 6 hours of CE per year that I get just for being a member and just for going, right? That's how they've kept me engaged, and that's how we keep many others engaged. We provide that education. People see it as a benefit. People see it as the ability to meet and mingle with people, as well as get some education that will help me in my practice. With that, I will open it up for any questions that anyone has.
All right. Thank you so much, Matt, for your time and expertise today. If anyone has any questions, you can raise your hand to have your line be unmuted, or you can type them into the question box, and I can read those back to Matt at that time. If you don't have any questions and you need to exit out of the system, please fill out the survey that will appear after you exit, and we will use that to help plan our additional sessions in the future.